A regular cleaning, or what is called a prophylaxis, has a distinctive difference from a periodontal maintenance therapy. A cleaning is what most patients feel they are going to get at their semi-annual checkup with their hygienist. A cleaning involves removing built-up plaque and calculus, also known as tartar, along the visible part of the teeth. A regular cleaning is recommended for all patients who have generally good oral health without the presence of bone loss or gum problems such as bleeding, inflammation, infection, or recession. Periodontal maintenance addresses the roots of the teeth, your gums and bone. This takes the place of a prophylaxis and is recommended once a patient has been diagnosed with periodontal disease and has undergone a therapy such as deeper scalings or periodontal surgery.